All right, so our final nutrient is the minerals. So similar to our vitamins, I love that you're all saying it that way now. That just makes me, makes my heart happy. You're not saying it like that. That's fine. So minerals are already in a form that our body can use. Unlike our carbs, fats, and proteins that our body has to break down, minerals we don't. They're already in a form. There's about 18 different minerals that we need nutritionally in varying amounts. We have two different groups. We have micro minerals, micro meaning small, and macro minerals, meaning large. Now, micro and macro refers to the amount that you need in your diet, not the size of the mineral. You don't have like this giant boulder sized mineral that you're trying to get in your face. So macro and micro are the amounts needed in the diet. Micro minerals are very small amounts, and they're also known as either trace elements or, oh my goodness, trace minerals. Wow, Doug is just not on the wheel today. Doug is somewhere else. Trace elements or trace minerals. Meaning you just need a tiny little bit, just a trace of it.
Just a hint.
Just a hint, just a dab. Just a dab in the diet. So those are our two groups of minerals. I'll give you guys a minute, furiously writing away, which is absolutely fine.
And did you do the same thing with this one where you like highlighted the testable material? Or?
I think I have a condensed version on my website.
Okay.
I don't think it's on the Moodle. I think it's on the website. Because there is a lot of information. Now, when we're looking at the minerals, one of the things I recommend, if you can learn what the minerals do, it gets to be pretty easy to figure out then what happens if you have, you don't have enough or you have too much. Because if the mineral does a job and you don't have the mineral, it can't do the job. So instead of trying to memorize, because you're never going to be able to memorize all of this information, but if you can simply critically think through and learn what in general do these minerals do, then you can kind of critically think through, and if I ask you deficiencies or excesses, then it makes it a little bit more manageable. Macro mineral, these account for most of the minerals in your body. We do need them in higher amounts. We do find them in higher amounts. I'm not going to test you over this grid. This is just so you can see something. Calcium, phosphorus, and potassium are found in the highest amounts in your body. We know that calcium builds strong bones, has to be maintained in a 1-to-1 ratio with phosphorus. But some other stuff that calcium does, calcium is actually a pretty groovy mineral. It doesn't just build strong bones and teeth, which every single one of us knows that. Calcium is also playing a role in clotting. Remember the clot ladder I showed you? It's one of the rungs on the ladder. Calcium is also involved in having one of your nerves fire. I don't know, have you guys gotten to the neural system yet? Not yet. That's okay. It's one of the neurotransmitters. So nerves are the great social distancers in your body. They don't want to touch anybody else. So in order for us to send a message, we have to have something that goes across the divide, goes across the social distancing and sends the message. Calcium happens to be one of those things. I know that you guys have done your muscles. If you remember, I'm going to say a lot of medical words right now. Let's see if we follow along. Remember, when when a muscle fiber gets a signal from a nerve, we have the sarcoplasmic reticulum where calcium is stored. Calcium floods out of the sarcoplasmic reticulum. It binds with the tropomyosin converting it to troponin, and that allows our actin and myosin to interact with each other. So without calcium altering the shape of that particular protein, our muscles don't fire. And in fact, for those of you that are interested in getting into like a food animal, like large animal veterinary medicine, very common, especially in our dairy cows. If you over milk them, guess what they become deficient in? Calcium. Calcium. And without calcium, their muscles don't
They
contract.
can get like super stiff and stuff, right?
Yeah, they'll go down. It's
Yeah.
called a downer cow,
Yeah.
where they'll fall down and they can't get back up
That's
because
when
their
they
muscles
gotta-
won't contract.
So they gotta load them up with calcium.
And then you load them up with calcium. Yeah, you can kill them pretty darn quick. We also see it in like medium and large breed dogs that have incredibly large litters. Because if you have 10, 12, 13 puppies all sucking the calcium out of mom, the medical condition, we call it, the common word for it is milk fever. The medical term for it is eclampsia.
My dog would go into seizures because she would not get up, just let her pups and she would get her so sick.
Yeah,
She would go into seizures because they were just sucking her dry.
they just suck her dry.
Acidic practice.
Yes, eclampsia and pre-eclampsia.
Pre-eclampsia is what I've heard of before.
Yeah, where you have, your body is having trouble, because pre-eclampsia is when the fetus is still developing. But guess where all of your calcium is going at that time? To forming a skeleton. So your body, mom's body, is getting sucked dry of calcium, and so you can get the pre-eclampsia, which is where your calcium levels are starting to go. We haven't gone yet, but now we can take measures to prevent that from happening. And it'll cause seizures, it'll prevent your muscles from contracting, all kinds of terrible things.
High blood pressure.
Oh my goodness, it'll Well, because- blood pressure is kind of dependent on your heart rate. Well, your heart is a muscle, and we've just talked about calcium's role in muscle contraction. Well, that's not just for your skeletal muscles holding you up. That's all of your muscles. So if you don't have the calcium to make your heart go, guess what? Your heart don't go. Right? Your heart doesn't beat. And if your heart's not beating, you're dead. So yeah, it's calcium, death by calcium. All right, so we're just going to start at the top. We're going to start with our macro minerals found in the body in higher percentages. So the first one is phosphorus. Now, I am not going to test you over whether it is an anion or a cation. An anion. Yeah, or a cation. I am, however, going to ask that you do know the letter designation, the chemical symbol.
Okay.
On the minerals test, just full disclosure, some of the questions are worded where I name the minerals by name. Other questions, I use the chemical symbol. So you're going to want to know both. Now, phosphorus is pretty easy because their chemical symbol is the first letter of the name, P. Phosphorus has a similar role to calcium. It helps with bone formation. In fact, it's what we call a primary constituent. A constituent is, in my mind, I think of it like an ingredient. It's one of the main things that you need to build bone. Helps with muscle formation. It helps your energy producing nutrients be utilized. Okay, so minerals, just like we talked about vitamins, minerals themselves do not produce energy. They are a non-energy producing nutrient. But they do help your body utilize the energy producing nutrients. So although these are not actively producing energy themselves, without them, your body cannot use the energy producing nutrients to get the energy. And then reproduction. And that one's pretty much across the board. Anytime you have any nutrient deficiency or imbalance, you're going to have reproductive issues. If your body doesn't have what it needs to sustain you, Your body is not going to allow you to get pregnant, because if you don't have what you need, how are you going to form another being? So one of the things we look for in animals that do have reproductive issues is, do we have some kind of nutritional deficiency? So let's just kind of critically think this through. Phosphorus aids in bone formation, muscle formation, production of energy, utilizing the energy, producing nutrients, and reproduction. Without moving forward or cheating, knowing what it does, what can we deduce would happen if I am deficient in phosphorus?
You will be infertile.
I'm going to have reproductive issues, infertility.
You have bad teeth.
I'm going to have bad teeth,
Stunt growth.
stunted growth because no energy.
Probably weakness.
I'm going to have lethargy and weakness.
Really thin, yeah.
I'm going to have weight loss. I'm going to have brittle bones. I'm going to have spontaneous fractures. And that was just where and your leg just breaks underneath you. You're going to be a Chinese crested. In fact, if I'm not mistaken, I think Ms. Regalia just posted something on Facebook in the all cohort page about the cat.
Yeah, I've seen that.
It was a cat with and her sister's cat had a non-traumatic spontaneous fracture of the femur,
That was so bad.
and it was terrible.
Like, and completely in half.
Yeah, it's mid-shaft fracture, non-traumatic fracture. All right, well, let's see how we did. Let's move the slide and see how well we did as far as our deductions. Well, look at that, deficiency. Decreased growth because we don't have the energy producing nutrients available. Decreased appetite, dull hair coat. Why do I have a dull hair coat? Yeah, because the protein. I'm not able to utilize the protein, and my body is certainly not going to waste protein on hair. There's my fertility issue, my spontaneous fractures, and then other bone formation issues like rickets. And I had you guys all do a Google image search of rickets. So any kind of bone formation issue. Good job. Look at that. See? If you can figure out what it does, if you can remember what it does, it gets pretty easy to deduce what happens if I don't have it. This is a radiograph of a leg. This is actually a lower back leg, I can tell, because this is a tibia, and that's the fibula.
And you can see the hawk.
And there is a fracture right here where that arrow is. So just showing you, I like to show you guys radiographs. I find radiographs pretty cool. Pretty cool.
Show me the tibia and fibula on there again. I know where they are.
The big one is the tibia.
And then
The little one behind it is the
I just
fibula.
never seen it on an X-ray.
This is the knee right here. This would be the stifle joint.
So that's looking down ventrally.
So this would be the leg is on its side like this.
Oh, okay.
And then you can see the tibia right here. This is the tibial crest.
Mm.
So up here would be the femur, the patella, and then you have that big ligament that attaches here
Okay.
down onto the tibial crest. Down here would be the metatarsus and the tarsus. So here we have a fracture in the distal third of the tibia and fibula. It's what we call a non-displaced fracture, meaning that the ends are still pretty close together. We don't have to do a whole lot to fix that. Probably a nice plate, maybe a pin, intramedullary pin, more likely a plate and some cerclage wire. This is the kind of stuff I did when I was in clinic. This is the kind of stuff that we would fix.
So is that like a hairline fracture or?
It's not a hairline because it is definitely all the way through.
Okay.
Hairline is where
It's just a crack.
it's just a crack, just a wee crack.
No, that's actually a.
This is a fracture, but it is what we call non-displaced.
Okay. 'cause
So
it's
the
still in same
edges are
place.
still relatively close together.
Okay.
Displaced is the cat that Ms. Regalia showed, where the edges were like not even
Yeah.
close. And then you have your simple fracture where the bone is still inside. And you have your complex fracture where the bone juts out, pokes out of the skin. There are all kinds of different fractures. You'll learn about those, I think, next semester when you get into your canine feline class. You'll learn about green stick fractures and spiral fractures. And things. There's a picture of a dog with rickets,
Aw, it's so cute.
pretty advanced. There's not a whole lot we can do. Now, if it is nutritional, obviously we can correct the nutrition and hopefully at least partially resolve or at least prevent it from getting this bad. That's what we call a reversed radiograph. Because normally bone is dense. How is bone supposed to show up on a radiograph? What color?
Gray.
Yeah, gray or white. This is a reversed radiograph, meaning that the bone is now showing up black. This is not something that we would do in general practice, but it does kind of serve to show the malformation. And what we're seeing here, again, these are back legs. So this is the tibia and the fibula, and you can see just how bowed. Here's the metatarsus. So the tarsus and the metatarsus.
So rickets is like another way of saying bow-legged dog. Kind of.
Yeah, well, yes, but can you have a bowed-legged dog that does not have rickets?
Yeah.
Yes,
Oh,
yes, you can.
okay.
Like your bulldogs,
Uh-huh.
your dachshunds, your bassets, the achondroplastic dwarfism dogs
Okay.
will have bowed legs and
Mhm.
malformation.
Mm.
That does not necessarily mean that a dachshund's legs are all twisty because of a nutritional thing.
Right.
It's genetics.
Okay.
This is nutritional.
Okay.
Now, can you also have rickets that is genetic? Of course you can. This
How
is
can you tell
what,
the difference if it's nutrition or genetic?
do further testing.
Okay.
You're gonna do further testing. You're gonna check the blood levels.
Okay. Okay.
And the
then it goes
nutritional
deeper, it runs
levels.
deeper.
Yeah, just looking at a radiograph, there's no way for me to tell. There's no way. So I'm gonna have to do that, blood work
Okay.
and analysis and do genetic screening. Is there anywhere in the lineage that we see this?
So then you do like the process of elimination.
Yep.
Okay. All right.
That's really what veterinary medicine is. It's just eliminating stuff that it can't be.
Okay.
Yeah, you
That's it.
play the odds. In fact, what most doctors will say is when you hear hoof sounds, think horses, not zebras. If you hear the beating hooves coming up behind you, you're going to expect to see a horse. You're not going to expect to see a zebra. Right? That's kind of veterinary medicine. So we're going to play the odds.
All right.
All right, so if I have too much phosphorus, I want to talk about this first one. If I have too much phosphorus, so we know that phosphorus's primary job is bone formation. If I have too much, why the holy heck am I losing bone? Well, shouldn't I be putting on excessive bone?
They're gonna eat the bone? They're eating the bone away, or?
It needs its best friend, calcium.
Because I need the one-to-one phosphorus and calcium. Well done. So remember, what was the vitamin responsible for the Match.com calcium and phosphorus?
D.
Very nice, Zoomer. Vitamin D. So if I have too much phosphorus, that means I've got all of these little phosphoruses who are sad and alone. They don't have a friend. I need to find them a buddy. Where am I going to find them a buddy? In the bones. So I start sucking out the calcium to get them a buddy. Well, if I start sucking calcium out of the bone,
You lose bone density.
I'm gonna have bone loss. This is where we start seeing nutritional issues, excesses in our large and giant breed dogs. Specific more to calcium, because the opposite is true. If I have too much calcium, I start sucking phosphorus out of the bone. So you have these owners who are like, I want my dog to be as big as a pony. And you're just like, I know that calcium builds strong bones.
So they
And he
overload
just
them.
over supplement calcium, and the opposite effect happens because now we got to suck out the phosphorus. If I have too much phosphorus, I suck out the calcium.
So that one, you can go hand in hand switched over.
Yeah, I
Okay.
gotta have phosphorus, calcium, 1-to-1 BFF.
Kind of like a lock and key. That's to go together.
Phosphorus excess, well, what your body doesn't use, it gets rid of. And in this case, when your body is getting rid of this mineral excess, it's going to get rid of it via the urinary system. There's really only a couple of ways your body can get rid of stuff. You can throw it up before it even gets to your digestive system. You can pee it out, you can poop it out. That's pretty much it. Minerals are pretty much going to be filtered out by the kidneys and eliminated in the urine. So what ends up happening is I develop urinary calculi. Somebody tell me the word calculi. Stones, bladder stones. What happens?
Would that be the same with crystals or no? Different.
So yeah, the phosphorus, crystals are the precursor to a stone.
Okay, okay.
So what's going to happen? What is normally in your bladder?
Urine.
Pee. Urine. Yeah, it wasn't a trick question. Urine. Urine is in your bladder. Urine is liquid. Now I've got an excess of these phosphorus molecules, which are hard. Think of them like little microscopic tiny stones. This is a mineral. So now these minerals are accumulating in the bladder. They're kind of banging against each other. And the bladder is like, ow, I don't like that very much. Causing irritation on the inside of the bladder. And so what does the bladder try and do? Protect itself. So it starts laying down layers of mucus as protection to kind of pad it from this phosphorus molecule slamming into the sides of the bladder. Well, what happens is now the phosphorus molecules are getting all sticky
They're getting stuck together.
and they're getting stuck together. And the more they get stuck together, the more damage they're doing, the more mucus we form, the more they get sticky, the more they stick together. You start to see.
Yeah, and that's what.
And that's when we start getting a bladder stone.
And they always have to be surgically removed.
I don't like to use the word always. There are some that can be dissolved with nutrition
If they're small enough.
if they're small enough. There are some that always have to be removed surgically with a cystotomy.
Yeah, I've seen a little Yorkie, this girl, it was like 12 years old. I don't know how long before they had these. There was 3 ones and they were like this big.
Yeah.
And a Yorkie.
Yeah,
Yeah.
we had to do surgery on the mouth, and she had gallstones, and they were the size of like pebbles that you see in like the driveway, and they were just like popping them like pimples, just
Yeah.
like pushing it out, and then they're like, "You want to see Molly's like stones?" And I was like, "Yeah," thinking they're small. No,
No,
like
they're
this
huge.
small.
And bladder stones can get to be humongous. The biggest one I think I've ever seen, excuse me, was in a soft-coated Wheaten Terrier. And she'd had urinary incontinence. She's just dribbling urine. So we finally did a radiograph, the owner allowed us, and she had a bladder stone that was probably the size of a small cantaloupe. And the reason why she was urinary incontinent is because the bladder was stretched around the
Oh
stone.
my God.
There's nowhere for the urine to accumulate, so it would just dribble out of her all the time.
Yeah, because that pussy thought she had like an UTI or
Yes.
developing it, and because we're like, "Why is she peeing so much?" And I found out
Yep.
she humongous stones.
It's crazy how big they
But
are.
It's crazy how big. The other thing that phosphorus excess can do is the little phosphorus molecules can sometimes enter the soft tissue. Now, this is pretty rare, but really devastating. So what it does is it causes the muscle and the soft tissue to mineralize. So it's not like a BB where I could like make a little hole and pop out the BB. Did y'all know we have a dog downstairs that's all filled with BBs? We found at least 3 BBs.
Who is it?
We have a dog named Scooby.
Is it
that's
Chester?
pellets. All it is a dog.
It was Hunter.
Oh, baby boy.
Yeah, Hunter the lab, the hairless lab.
That's like you.
Yeah, well, he's
The
got
brindle one? Oh, I was
not
like,
a brown. He's kind of a brown lab.
Albie.
Alvy.
Alvy, that's it. Alvy, not Hunter. Alvy.
Oh.
No, we did 4 dogs last week. We did Hunter, Alvy, Chester, and Cheddar. It was Alvy.
Oh,
And we did
yeah.
thoracic radiographs and we found 3 BBs.
He's so sweet too.
But we're not gonna do anything. Like if we, and you can feel one of them.
Oh.
Yeah, you can feel it under the skin. We're not gonna do anything. But this is not that. It's not like I can make a little hole and boop, pop it out. This is where the tissue itself has mineralized. I've got a radiograph coming up. And so calcification. Now, calcification does not necessarily mean calcium.
Mhm.
Calcification means to mineralize. So we've quite literally turned soft tissue to stone. And then finally, we have hyperthyroidism as a secondary condition. So what is happening if I have hyperthyroidism?
Excessive thyroid.
Yeah, excessive thyroid production. Thyroid is what controls your metabolism. So if I have too much of it, your metabolism gets too fast. You start burning energy too quickly. So those are the symptoms of a phosphorus dietary excess.
Is it
And that's common in pets.
Yeah, cats more commonly get hyperthyroidism as a primary condition. When we're talking about a secondary condition, secondary means it's a clinical sign of something else going on. But you're absolutely right. As a primary condition, cats get hyper, dogs get hypo.
So you said it's not babies. Does that mean it's like big areas?
No, so let me show you the picture because I think visually this will help. Here I've got a radiograph. And you see all these little white dots right here, especially like right up here? Well, we know that bone, the harder, the more dense something is, the whiter it shows up on a radiograph. Well, look at, these are just as white as bone. But it's not like I can make a little incision and pop them out. This is where the tissue itself has turned essentially to bone.
So it's like embedded.
So and it's not even embedded, it is, the tissue is now bone.
It became
Is
the
that
bone.
painful for them or?
Absolutely, it's
Yeah.
painful because we now have muscles and stuff that are supposed to be able to stretch and move.
It's hard.
Well, now it's mineralized. So we're gonna have part of it stretching and moving and part of it not, and we're gonna suffer some pretty dramatic injuries from that. Here I've got a radiograph of an animal in lateral recumbency. And you can see the big bladder stones right there. Here I've got some examples of some bladder stones.
Oh my God, they did spiky like that?
Oh yeah, depending on the mineral, phosphorus is not the only mineral that can cause stones to form. So when you remove the stones, you send them to the lab and they will confirm what kind of mineral content, and then we can alter the diet accordingly. You can get stones from phosphorus, they can be made of phosphorus, obviously calcium, oh, come on. Uric acid, Dalmatians are prone to uric acid crystals. And so depending on the mineral makeup will determine the shape. So you've got some stones that are smooth like a river rock. You've got others that look like a jack, like the game jacks. You know what I'm. We've got others, this is known as a rosette. This is very common for calcium. And this is like razor sharp. Razor sharp. If you took this stone and you put it in your hand and you squeezed it, it would cut you. So think about that for a minute. How much tougher is the skin on my hand than the tissue inside of my bladder?
Right.
So you're for sure gonna be bleeding.
You're gonna have a lot of hematuria. You're gonna be passing clots.
Does
Yeah.
your bladder ever thicken?
Does what?
Does your bladder ever thicken?
Thicken? Absolutely. Yes. When your body is protecting itself, one of the things that it does is it lays down additional layers of tissue to protect. Think about you have a callus on your foot because your shoe constantly rubs. You get calluses on your fingers from playing the guitar. Inside of your bladder, the bladder wall will thicken. But what that now does is it causes the elasticity to be compromised. So now the bladder can't get big and thin anymore. It's a defect balloon. And so that's where you're going to get cystitis and urinary incontinence. Now you're thinking like a technician. So those are all of the things with phosphorus. Comments, questions, concerns about phosphorus. Minerals are really, I find them pretty fascinating. We don't think about them at all, but they're pretty important.
It's a little off subject, but like when I need a burp, I have real bad gastritis, so I like to drink the mineral water with a little bit of lemon. It helps you burp. So what is in all that mineral water that it helps you burp so much that it's so carbonated?
I have no idea why it's helping you burp. It has minerals in it. I don't honestly know.
Mineral water is disgusting.
It's not carbonated.
It does taste like dirt.
Yeah, I use it a lot for like, I use it a lot when I need a burp.
Are you drinking it sparkling? Because most mineral waters are carbonated.
No, I like to buy the Tampico, and I just put some lemon in it. I drink it real quick, and then it makes me want to burp.
Well, anytime you drink or eat anything very quickly, you're ingesting air as well. So remember the anatomy of your stomach. Your fundus is the pocket where we have gas.
Right.
If you're ingesting air because you're drinking very quickly, the fundus gets full prematurely, and then you get that little diaphragmatic burp, and up it goes.
That makes it cause that burping.
Cool. So that's not necessarily due to the minerals, it's how you are drinking.
Oh, okay.
It would be the same if you had iced tea. There's nothing in an iced tea that makes you burp. It's you guzzling down a glass of iced tea that makes you burp.
It's carbonated. Yeah, that's
Especially if it's carbonated.
yeah, that's what I'm saying. That's what the carbonated mineral water.
Yes, carbonation is definitely going to make you burp. So hyperthyroidism, this is a lot of words. I'm not going to expect that you know all of this. I know, I see the eyeballs. Get them back in your face. All this is saying is describing what is hyperthyroidism. Hyper meaning excessive. So your body is producing more thyroid hormone than what it needs. Thyroid hormone regulates your metabolism.
That's how they get obese.
For hyper, they're going to go thin.
Yes.
Hypo, they get fat. Hyper, they get thin because their body is using the energy faster than they can take it in. So we're constantly having to pull stuff out of the storage unit to make up for it. So that's all of the things that you can think of associated with an increased metabolism. You're going to have weight loss because your body's using the energy faster than we can take it in. You're going to have hyperactivity, increased appetite. They're just going to sit at the food bowl because, again, their body is using energy faster than they can eat it. So their brain is telling them constantly eat. And so they constantly eat, but they refuse to put on weight because their body's using it so quickly.
So do they, for the felines, do they test for that like when they do blood work, like normal blood work? Is that like an automatic?
Not an automatic unless we're seeing clinical signs or it is a senior pet. It's usually included in our senior chemistry analysis. Because old cats will get one of three things: kidney disease, diabetes, hyperthyroidism.
So it's rare to see in like a 4-year-old cat.
Very rare to see in a 4-year-old cat. Now, we do have things like thyroid tumors that could cause the hyperactivity and the hyperproduction. You also have things that, like in your brain, it's a gland, it's the master gland, it is the pituitary gland. You have a pituitary tumor, and it's causing an overproduction of the thyroid stimulating hormone. So there are other things that can cause
Would this cause
hyperthyroidism.
like protein in the urine or no? That's just more kidney. So.
Yeah, that's proteinuria and bilirubin is probably going to be more kidneys.
Okay.
This is where the thyroid is. It's in the throat. You don't normally be able to feel it. It's going to be right here underneath your larynx. All right, so the BFF of phosphorus is calcium. The chemical symbol for calcium is Ca. And everything we just talked about: muscle formation, teeth formation or bone formation, muscle function, blood clot, nerve transmission. It is a neurotransmitter, and it allows things to pass back and forth through your cell membrane. So a lot of important stuff. I mean, we often just say, calcium builds strong bones, but without it, you don't clot. You don't transmit nerve impulses.
You can't flex.
Your muscles don't flex. Your stuff can't get back and forth through your cells. Stuff like, nutrients and oxygen.
And your brain can't work.
And then you die. And then you die. Calcium can kill you. That's why if you have ever watched although who's the one I hate?
Dr. Cole.
Yeah, I hate him. I love that I just have to say who's the one I hate. And you guys are already living in my brain so much that you're just psychically connected to me. I hate him.
He like loads cut.
I hate him. I hate him. If you want to know what not to do, watch his show, because everything that he does is wrong.
How does his patient find?
He's awful. He is a terrible, terrible veterinarian.
So how is it that he's a veterinarian if he does everything opposite?
He may not be for much longer. He's got like 3 lawsuits against him. I think that the channel has yanked his show.
Yeah,
Takes his shirt off and
Oh my God. So everything he does, now guys, I'm triggered. Oh my God, I'm triggered.
Every time we talk
Wait, who are we
about
talking about?
Talking about the idiot the amazing Dr. Pol.
Oh.
He is awful.
I like
And-
Dr. Oakley.
He's awful. He's awful, awful, awful. How that man has not contracted brucellosis and died is beyond me.
brucellosis.
Brucellosis is a condition that cows get. Now, in cows, usually they can be asymptomatic, meaning they're not showing symptoms. If a human gets it, it causes spiking, what we call an undulating fever. So imagine, think back to the sickest you've ever been in your life with a super, super, super high fever. And you're, and then the fever breaks and suddenly you're just drenched in sweat. And then the fever comes back and you're freezing again, and then it breaks and you're drenched in sweat. Think of the worst fever you've ever had. Now imagine that happening for the rest of your life nonstop.
Oh, shoot. Non-curable?
Non-curable.
That's
No, thank you.
not good.
How do you get it?
That's a fabulous question. So you get it from direct contact with an infected cow. So if I have a hangnail, if I have any compromise in my body,
You're not wearing gloves.
and I'm not wearing gloves, and let's say here's a cow and I'm Dr. Pole, so suddenly I'm getting naked because everybody wants to see a 60-year-old
In
little
Michigan,
Polish
where it's
guy
cold.
going head first into the cooch of a cow.
Yeah.
So he's like, I'm in. And he starts getting naked and he just goes diving in, no glove. If he has even the tiniest compromise, bam, brucellosis. I had
He is 70 years old, so I mean,
I don't care. He's
He's-
awful. He's absolutely awful.
It's like that old school.
I don't think.
Now there's
It is-
old
it is
school
different.
and then there's irresponsible.
Then there's unorthodox. He's unorthodox.
He's not unorthodox. He is just criminal. He is awful. He is awful.
He's a
He is
perfect example of
terrible.
they give a degree to
There's
anybody.
nothing there to warn the patients up at all.
And he doesn't, half the time, he doesn't even sterilize his instruments. He
I wanna
very
know where-
rarely uses surgical gloves.
I wanna know where he got his education from.
I don't know, but
It's from a different country, isn't it?
Yeah.
you still have to take
Poland.
American
Yeah, in order for him to
medical
practice here,
boards
he
to
has to-
become
And just
licensed
like
here.
He's gotta be in the
State,
state
you have to
and
state
in
for
the
it.
region.
Yeah, he's
Done
not
that too.
comforting me at all because this girl's horse was like frolicking and like it fell and he was just like, well,
Get a gun.
yeah, he was like, well, your horse is gonna die.
He's awful. He's terrible, and I hate him.
There's this 12-year-old girl like,
I hate him. I hate him.
He's old.
I can't tell you how much I hate him.
this one's like,
Hate him.
Oh, yeah, what is it, Dr.
I was watching
T,
some
I think it
castrated
is.
pigs and I was just like.
I can't watch any of those shows because they drive me insane.
I just don't like that she's always trying to take pictures with the animals.
Miss Rivera's
No.
Gulf Coast. You don't like watching that?
You know what? I watch Netflix and Hulu. So unless it's on Netflix or Hulu, I don't watch it. Although I do like Gulf Coast because I have a lot of graduate students who work at
Isn't
Gulf
Miss
Coast.
Rivera from there?
Yes.
Yes.
And so I have a lot of students who come from there and who work there.
Don't they have
So
a
that
lot
one
of
was
animals?
always fun for me to watch because I'd be like, oh my God, there's so and so. Same thing with the SPCA, the Animal Cops Houston,
Mhm.
because I know the head veterinarian and we have like most of their staff is made up of graduates from our program. So I would watch that show and I'd be like, oh, look, there's so and so. So proud.
I like that show.
All right, calcium deficiency. If I don't have calcium, well, we just do the same thing we did with phosphorus and make deductions. Decreased growth and appetite because I don't have the ability to use my energy producing nutrients. I can't mineralize my bone if I don't have the mineral. Right? That's kind of a no-brainer. Lameness, fractures, teeth, tetany. I want to talk a minute about the difference between tetany and convulsions. Tetany and convulsions has to do with the involuntary contraction of your muscles. So you have your skeletal muscles, which are voluntary muscles. You choose to move them. But what happens if you don't? What happens if they contract all by themselves without you wanting them to contract? So a spasm is a minor convulsion. So a convulsion, by definition, is you don't have to write this down, it's just, I'm putting words make a picture of your head, in your head. A convulsion is an involuntary contraction of a voluntary muscle followed by a period of rest. Let me show you what this looks like.
Oh. A seizure?
Seizure and convulsion, same thing. Tetany is an involuntary contraction of a voluntary muscle with no period of rest.
So just keep going.
Oh. Oh my goodness.
Oh, so it's stuck. You're stuck.
It's like a bit like in a rigor mortis state. They're just stuck.
It's a live rigor mortis.
That'd be awful. There was a dog on Facebook. Oh my God. I'm about to open it.
There, and you guys are doing your parasites right now. Have you done your ectoparasites?
Not yet.
We're starting
We're
this.
still.
You're starting them. There is an ectoparasite called a tick.
Mhm.
Yes.
Yeah.
And the the saliva of the tick, some animals can have a reaction to it, and it causes something called tick paralysis.
Mhm.
And they just stuck like this. So convulsion is followed by a period of rest. Contract, relax, contract, relax, contract, relax.
So you, like, if that were to happen, you basically just kind of have to put your animal down.
Not necessarily, it depends on why. So
Would you
if
give them
we're talking
medication?
about a calcium deficiency, what could I do to resolve it? Give them calcium.
Or I was talking about the tick,
Oh no, you remove the tick,
and then it's like.
find the tick, take it off, and within 45 minutes, they're usually doing much better.
Mhm.
Wow.
Yep.
Oh, it's insane. And it can be caused by one tick. Oh, you'll learn about tick paralysis. It's crazy.
I love
You can get one tiny tick, and where it was really, oh my gosh, I'll never forget this one. I haven't seen it a lot, right? It's not a super common condition, but when you see it, holy smokes, it will stick with you for the rest of your life. We had husky,
Harry.
double coated, right? Because huskies and Malamutes have the double coat.
Yeah.
That's a forest.
Tick paralysis. So guess what we had to do? Shave it.
Aw.
And even when you find one tick, can you just stop and, no.
No.
You have to go over literally grid the entire animal. And we're talking in between the toes, inside the pads of the creases of the feet, inside the ears, underneath the tail. Every centimeter of this
Even that
animal
little drop
has
in
to
the ear.
be checked. Because if there's even one lot missed, because it will progress and kill them. Whew. Yeah, but if we're talking about a calcium deficiency, just give them some calcium. Now we got to give it slowly because it will kill them. But yeah, just give them calcium. When we see calcium deficiency in our nursing animals, in our dairy cows, you do hang a bag of calcium gluconate, and they'll do pretty well.
So when you say that they need calcium, you said calcium and phosphorus go 1-1. Do you need to give phosphorus as well?
You may, depending on how deficient the calcium is.
How do you give calcium?
Intravenously.
Okay.
Yeah, you place a large bore catheter and just like IV fluids.
How do you know how much to give them though without overdoing it?
You go, hello, doctor, how much of this medication would you like me to give?
Okay.
That's what you do.
You don't do like Dr. Paul and just chug it down.
God forbid.
No. But that's also why I have LVT behind my name. So sometimes those decisions are not in my hands. I don't have to worry about it. The doctor is the one that's going to say, I need you to bolus this much and then maintenance this much. So here I have two pictures, although it's really hard for me to show you a picture of a convulsion, right? Because it's a still shot, but this is convulsion. This animal is, think grand mal seizure. Now I do want to just give you my tech tip. When they are having a grand mal seizure, and this is tetany, okay, this is what we call the sawhorse stance. If you've ever been any kind of construction or a DIY, you know the sawhorse where there's two wooden pegs and then you have your work. That's what they look like. They look like an A-frame sawhorse and they're just stuck.
They're stiffened like that.
They're just stiff. Look at this leg. They're just stiff. They're just stiff. This guy, however, is completely incoherent. He doesn't know where he is. He doesn't know what is happening. He is essentially comatose. He doesn't see, he doesn't hear. If you accidentally get anywhere,
Don't bite you.
they like an alligator.
They clamp and don't let go.
Well,
won't
they
open up.
can't. They'll clamp and can't let go
They get locked down.
because their muscles are contracting. Had a technician, we had a dog, it was not calcium related. Dog was just having seizures. You're gonna lay on him. Because what's happening is as they're seizing, they're slamming their head into the floor. You can have dogs break their jaw, break their orbit, because they're literally all their might, and they don't know they're doing it. So we're gonna sit on him and prevent him from slamming him into the floor. She got her hand. She was like, oh my God, he's gonna bite his tongue. And I'm like, get away from his mouth. And she went to touch his tongue and he broke every bone in her hand.
Damn.
He broke every metacarpal in her hand.
Oh my God.
Yeah. And there was nothing we could do.
Yeah.
She had to just wait for him to let go.
That's it.
It was terrible.
What did you just hold the head down?
He's convulsing.
Yeah.
I don't get anywhere near this part.
Yeah.
I'm gonna come up behind the
Yeah.
ears
Yeah. So
and hold it down. And I'm gonna like physically be not putting my weight on him, but he's gonna be between my legs and I'm gonna be, and because you have no idea how strong these contractions are. And so you'll just stiff arm him and even then he'll be bucking you.
I would have to bear hug my dog pretty much when she would do it.
Yeah.
She was a big like Pyrenees mix.
A calcium excess. In our large animals, it's going to decrease how efficiently they can use their feed. It's going to cause nephrosis. Nephro meaning what? Yeah, kidney. Because guess how the excess calcium is removed from the body? Through the kidneys and the urine. So you're going to have kidney disease, lameness, because we're sucking phosphorus. You're going to have costochondral junction issues. Costo meaning rib. Chondral meaning cartilage. That's one you can see on the radiograph. And that's almost exclusively going to be a calcium excess. And it's going to affect the bones. Again, because that 1-to-1 phosphorus ratio. And then in some cases, you can also develop bladder stones, just like with the phosphorus. You get a calcium oxalate, monohydrate, or dihydrate, depending. So you guys you just finished your endoparasites?
We're,
I think we're done.
yeah, we have like a couple more slides in coccidia, but other than that,
Okay.
we do a fecal one and then we'll start active.
Oh, I do love the endoparasites.
There's just so many.
Oh gosh, you have no idea. You're only having to learn a handful of dog and cat parasites. I had to learn every species in one class. We had over 150 different parasites.
Wow.
We'll learn more when we get to large animal,
She
right?
was telling us about how Miss Regalia got it. It was just like all parasites were the multiple tests. She just did it went all over, like went over all of them, and then they.
That's how I used to teach it too.
Oh God.
Oh, yeah, that is so hard.
And I used to do slide identification, fill in the blank.
That's what she said. She didn't know.
Yeah, slide identification. This is pre-COVID. So when you were bigger classes, when I'd have no one on Zoom, everyone would be here. And your tests were not online. They were paper tests that I would hand out. And I'd have a slide identification with a timed PowerPoint. It would transition after 30 seconds. And you would just number your paper and then you would have to write in the answer.
Scientific name or regular name?
Both, either. And the questions, it might be a picture of a whipworm and say, what is the term for the little bubbles on either end of this egg? The operculum. Or I would say, what is the medical term for this particular egg?
Ova.
What about for whipworm? What is the medical term for whipworm?
It's the one
Vulpes,
that sounds
something
like-
vulpes.
Trichuris vulpus.
I'm like something with the T.
I was like,
Yeah,
stop
Trichuris.
Harry Potter.
Trichuris vulpus. You can always tell the roundworm because they are
Round.
round. Very good. Oh, and we had to learn so many more than you do. We had to go into like the hookworm, Unsneria stenocephala. We had to go into the raccoon roundworm, which is called Balis
It
ascaris.
causes neural.
Oh yeah, it'd kill you.
Yeah,
That one. Well, you also have your hookworms,
that one's for kitchen.
and your roundworms will cause ocular larval migrans. Hookworms cause cutaneous larval migrans.
Yeah, we saw it in the photo.
You have others that can cause neural larval migrans, visceral larval migrans.
Yeah.
Oh, no bueno.
There's something nasty.
All right, so this is the radiograph. I love this radiograph. So when I was telling you that a calcium excess can cause costochondral junction enlargement. So here we have, this is the chest, obviously, because that's where your ribs are. What? You ever learned that in anatomy and stuff? No, that's where your ribs are. They're in your chest. Here we have the heart. And then if we look, I'll do this for my zoomers. Do you see right here how it kind of looks like cotton candy? And right here. This is where the rib cartilage is enlarged. You see, there's a rib, there it is. And every one of these, that cartilage is inflamed and enlarged. So that's what we're looking at with that costochondral junction. Very indicative of a calcium excess.
How do you know that that's going on?
How do you know what?
How do you know that that's going on in the animal?
Because I can see it.
I mean, like,
Oh, so I would look at this and go immediately run calcium levels. We're gonna need to do blood work on this guy and check calcium levels. The calcium phosphorus ratio we now know needs to be maintained in a 1-to-1. An imbalance of one causes an imbalance of both. So I can either be sucking it out or putting it in, and it's vitamin D that is going to maintain that 1-to-1 ratio. Different species have different ratios. For example, right now I'm taking an equine nutrition and care class because it's required for my degree. I couldn't care less about horses. I'm sorry, equine people, I'm sorry.
I love them.
I know how to ride a horse. That's about it. I know that they do need the same nutrients as far as, protein, carbs and fats, etc. Their digestive system's completely different. Where they get their nutrients is completely different, and the ratio of their calcium and phosphorus is completely different. But in cats and dogs, because this is a companion animal nutrition class, is a 1-to-1. Levels of calcium and phosphorus, they can be very harmful. We've talked about that. And one of the neurological symptoms we can see that you may have talked about in your behavior class in reference to your Doberman's is Wobbler's disease. Which is,
Exotics too, right, or no?
do what?
Rottweilers too?
You can really, nutritionally, you can see it in any breed.
Oh, okay.
Wobblers can also be a genetic,
Right.
found very commonly in Dobermans. And this is where the cervical vertebra, they get narrowed, and it causes a compression on the spinal cord. And when they walk like this. And that's why it's called wobblers, because they're wobbly. I'll give you guys a minute. Comments, questions, concerns so far? Is everybody okay? Am I going too fast, too slow? Perfect. Here's a picture of that wobbler syndrome, where you get the malformation in the cervical vertebra, and you can see here the compression on the spinal cord. Here you can see a little pinching right here of that spinal cord. And that's why it affects all 4 limbs, because it's affecting here. So the message going to everywhere else is being affected.
Is it always in the cervical vertebra?
Wobblers, yes. All right, so this is my favorite mineral. Of course, Ms. Huff has a favorite mineral. Potassium. Potassium, the chemical symbol is K. Why is potassium not the chemical symbol of P?
It's phosphorus.
Phosphorus already took it. So we got potassium, which is K. Potassium helps your muscles contract. Has anyone in here ever had a Charlie horse?
Yeah.
So,
Oh my goodness, they are awful. Usually it happens about, 3 o'clock in the morning when you're in the middle of a delicious
right when you're asleep.
dream. I get them in my calves.
I get in my calves and my feet.
And your foot just goes,
yeah.
It's like you can feel your muscles virtually pulling.
yeah,
you
your
in.
toes are all,
They're just like all screwed up.
and all you can do is sit and you just punch it. You just try and get it out and the muscle is rock hard.
I think I got it when I was pregnant.
Well,
I get those a lot actually because I don't drink a lot of water.
look at this. Muscle contraction and nerve impulse transmission. So if you are deficient in potassium, your muscles are not going to contract and your nerves are not going to transmit normally. And that's why they say if you're an athlete, you should supplement potassium. They say, drink pickle juice,
Yep.
Eat bananas.
eat bananas.
I eat pickles all the time and I still got them, so
I don't know, then you're just weird.
I guess so.
You gotta
You're
drink
just
the
bizarre.
juice.
I
Yeah,
drink
the
pickle
juice.
juice and the pickles, and I
I
have
love
nothing
pickles
behind
so
it.
much.
Then you need.
You gotta drink it like you're drinking a cup of water.
And then it helps with your osmotic balance, which remember is the movement of fluid regulating and then utilizing our energy producing nutrients. The 2 big functions though, the 2 biggies, put a little star beside, is the muscle contraction and the nerve transmission. Those are the biggies. And we're going to pick it up here with the excess and deficiencies of potassium on tomorrow. Potassium, just to give you a tickle for this, is what I would use in the perfect murder.
Oh, you told us. Wow, you used to be really helpful.
Yep. Potassium, they said that there was no such thing as a perfect murder. And I have created the perfect murder. I did.
You know you're recording.
Well, thank you.
In the belly button.
I need to get rid of my husband.
Oh, God, yeah.